Hello, my name is Melissa Long, and I'm the Director of Education and Support at Insight Memory Care Center. Today, we're going to be talking about normal aging or a neurocognitive disorder. Now what? Our mission at Insight is to provide specialized care, support, and education for individuals in all stages of memory or cognitive impairment, their partners, and our community. Our vision, a community where those living with memory or cognitive impairment and their care partners can achieve the highest quality of life. We are a leader in dementia care in Northern Virginia. Insight is a nonprofit that started in 1984 that supports families on their dementia journey. CARE, specialized adult day programs for people in all stages of dementia care, from mild cognitive impairment all the way to hospice. We connect by building relationships and support care partners on their journey. And with our creativity and dementia experts, we're sharing knowledge and resources because every journey is unique. So I want you all to think about that time back in the 80s when we didn't have locate your car on your phone. And we'd walk out of the mall and this is what we saw. And then we go, oh my gosh, where's my car? Think about that feeling you had, that moment. How did you feel? Were you fearful, anxious, paranoid, in denial? Did you feel depressed? Do you think to yourself, where did I put my keys? What was I just saying? What was their name? Where did I come in from here for? All these different things can pop up when moments like these happen. You want to blame yourself. You want to blame someone else. That anxiety that you get, that fear, the denial, the depression, the paranoia, that's what someone with dementia feels like throughout their day. So one thing, when we look at age-related changes in our memory and learning, is that there's 6 domains that are affected. And there's normal age-related changes in how we think and behave that are not connected to dementia at all. And it's important to understand the difference between normal aging and possible neurocognitive disorders like dementia. Some cognitive decline is normal, and memory is not the only function that is affected. There are 6 domains of cognition to consider when assessing normal aging versus a neurocognitive disorder, such as dementia. Do you notice behaviors and changes in yourself or your aging loved one, or your understanding these domains can help you to better communicate with your doctor and plan for future when it's necessary. So complex attention, language, executive functioning, perceptual motor, social cognition, and learning and memory. The brain has many complex and marvelous functions, including the memory, reasoning, and language. Researchers have broken down the brain's main functions into 6 cognitive domains and identified normal changes versus potential warning signs for neurocognitive disorders such as dementia. So when we look at our complex attention on our first domain, we see this as an ability to stay focused on complex tasks even when there are distractions going around you. So normal, we make a mistake in a recipe while talking to another person. That's normal. Potential warning sign that there's something more going on. It's not returning to finish a recipe after you got interrupted. So there's something raw sitting on the counter that you forget about. When we look at someone's executive function, this refers to the skills needed to plan, make decisions, respond to what is going on, and then move from one task to another. Executive function in older adults can change. It may take longer to process and respond to new information. So there's 8 executive functions. There's self-control, the ability to stop and think before acting. Emotional control, the ability to manage feelings, to achieve goals and complete tasks. Task initiation, the ability to start and finish tasks without procrastinating. Working memory, the ability to use information held in your memory to complete a task. Self-monitor, the ability to view and evaluate yourself. Flexibility, the ability to adapt to changing conditions by revising plans or changing strategies, organization, the ability to develop and use systems to keep track of materials and information. And lastly, planning and time management, the ability to create steps to reach a goal. So in normal aging, you might need assistance using a complicated new device, or occasionally missing a bill payment, but remembering later and being able to take corrective action. When we see that it's something more than normal aging is when having trouble completing daily tasks such as getting dressed or brushing your teeth, frequently missing bills, and other important deadlines. Our next domain is learning and memory. The brain is skilled at recording information and then being able to retrieve it. However, your brain doesn't hold memories as crystal clear recordings. So it is not uncommon that some memories get a little fuzzy. The stories change a little bit. It's like when you play telephone, you hear certain pieces. When we're aging, normally, occasionally forgetting where to put your keys or calling someone the wrong name happens. We're all human. We're not robots, right? Potential warning signs, though, regularly having trouble remembering names of people you see frequently and getting lost in familiar places is when we get concerned. The next domain we're going to talk about is language. So there are two forms of language: your expressive language, so what we say, and our receptive, what we understand. This includes speaking, reading, writing, using the correct names of objects, and using proper grammar. All of you recently, in the past year and a half, have heard a very common phrase on the news called primary progressive aphasia, which is what Bruce Willis has. And this has affected his language skills. So in a normal older adult, having that on a tip of my tongue feeling when you're trying to think of that proper word, and it may take longer to remember and express yourself clearly. But if it's more than just normal aging, you're having constant difficulty following the conversation, the plot line in a movie or a book, another warning sign could be using alternate words rather than the obvious words, such as calling an elevator the up button or calling ice cream cold. You start inventing new words. Then we have our perceptual motor, and those skills are connection between your eyes. Your eyes see what your brain understands. So for example, looking at a toothbrush and knowing that it's for brushing your teeth. So in normal aging, making a mistake in grabbing your hairbrush when you mean to grab a toothbrush can be normal. But if it's beyond having normal aging, you're going to see that you're going to have a greater difficulty returning the hairbrush to the proper place and picking up the toothbrush, which you know is the appropriate item. We look at social cognition domain in our brain. Our social cognitive skills can be defined as being able to feel empathy, understand motivation, and recognize and respond to others' emotions. These skills are fundamental to normal human functioning. Normal aging, we make a decision that others disagree with or saying things just a bit too bluntly, especially if this is typical for them. But if it's beyond just normal aging, a warning sign is having angry outbursts or frequent mood swings that aren't typical for them, or an otherwise outgoing and cheerful person suddenly becomes withdrawn. And a lot of times we'll see this with people who have been able to mask a lot of these symptoms, and they stop going to social events and churches because they can't follow conversations and they get overwhelmed by a large group of people. When aging, you can still learn new things, you can create new memories, and you can improve vocabulary and language skills. Some things that could cause these changes, so it's not always neurocognitive deficits that are causing this. It could be that you have an infection, like a urinary tract infection or pneumonia. You could have issues with your thyroid, kidney disease, liver issues, trouble sleeping, substance use, depression, anxiety, inadequate nutrition, poor vision, hearing deficits, and vitamin deficiencies. So it's very important to know that you can have some cognitive changes from these things, and they're fixable. And we want to be proactive and get diagnosed sooner so that the things that are fixable, we can take care of. Because the longer we hold off fixing those things and ignoring it, they can become long-term and not be fixed. So to get these checked out, you want to get a thorough assessment, a complete assessment to rule these out. So some tips, and when you have some of these memory issues, I want to give you some tips and tricks to compensate for this. I want you to write things down and ask for information in writing.
Use electronic reminders, organizational systems, pill boxes. Focus on one thing at a time. When you're younger, you can multitask around 4 to 5 things. As you age, your brain does slow down and you got to cut back on how many things you multitask. So go down to 2 or 3. Allow enough time for tasks to be done. Before you could get something done in 5 minutes, now you might need 10, and that's okay. Let yourself have the time. And ask others to slow down when presenting information to you. Don't be afraid to say to me or anyone else that's presenting or around you, slow down because I don't understand. That's only going to help you receive the information that you need. So aging and health, aging well depends on a couple of things. It could be related to your genes, the environment you live in, and the lifestyle that you hold. A healthy lifestyle choices may help maintain a healthy body and brain. So what can you do to protect your brain health? Well, the first thing you can do is taking care of your health in general. So we recommend health screenings regularly, managing health problems like diabetes, high blood pressure, and high cholesterol, consulting with your healthcare provider to make sure your medications are right for you. And one thing you can do is pharmacists know medications the best. And so getting your medication reconciled from your pharmacist and making sure you're only going to one pharmacy so that the same pharmacist can see everything you're on is a really good thing to do. Reduce the risk for brain injuries due to falls and other type of accidents. So if you're going to be out riding a bike, rollerblading, helmets aren't a bad idea. And then the other thing is to quit smoking if you currently do. Next, I want you to eat healthy, and that looks like fruits and vegetables, whole grains, lean meats, fish and poultry, low fat or non-fat dairy products, less solid fat, sugar and salt in your diet, a proper portion size, and adequate fluids. You've all heard of the Mediterranean diet. It's the best diet in the past 7 years, but there's another one that helps really well for brain health, and that's called the MIND diet, M-I-N-D. And that's a combination of the heart healthy diet and the Mediterranean diet. So it mixes both things so that you can take better care of inflammation in your brain. One of the most important things on this list for me is making sure you all get adequate fluids. And when I mean adequate fluids, I mean water. So older adults are prone to either not drinking enough and then their kidneys aren't flushing things out and we get a lot of urinary tract infections. But also water keeps your skin flexible and fluid and your blood pressure controlled and all these different things. So it's really important. You hear people that don't drink a lot can have hypotension, which means their blood pressure drops and then they pass out. So you really want to make sure we're getting those fluids in. And if you need to trick your brain because you don't like the taste of water and put Crystal Light in there or squeeze lemon or lime, something like that. But juices aren't adequate for that because they have all the sugar and that's what leads to those UTIs. So just be mindful of that. And drinking your coffee and tea is great, but that caffeine actually pulls away the liquids. So if you drink a cup of coffee, you need to drink 2 cups of water to make it even. So kind of keep those things in mind. And, you know, if you're not someone who also likes water, eating oranges, watermelon, Jello, popsicles, those type of things give you plenty of fluid as well. So that's an alternative. Next, I want you to avoid excess alcohol. So the guideline is, which I think this is so unfair, 2 drinks for men and 1 for women. And then less if you're over the age of 65. Alcohol has a couple effects on our brain. It can slow or impair our communication among our brain cells, even with moderate use. It can impact our driving, give us slurred speech, fuzzy memory, drowsiness and dizziness, and long-term changes to balance and emotions, coordination, and body temperature. And there's actually a dementia that we have in the plethora of dementias. There's over 170 different dementias. There's actually one that is brought on by long-term alcohol abuse. So if this is something that you or you know someone who did throughout their whole life and made poor choices with that, they could end up with a dementia that's related to alcohol. So that's something to always keep in mind. Next one, we want to get moving. Moving is so important, and I don't care how you do it. You can stand in front of your TV and run in place and watch I Love Lucy, grab the soup cans out of your cabinet and do reps with them, whatever works for you, but I want you to get 150 minutes of exercise every week. Move about 30 minutes on most days. Walking is a great start to that. Join programs that can help you move safely. Check with your healthcare provider if you haven't been active in a long time and want to start something very vigorous, just to make sure you're safe to do that. An easy thing you can do if you go on the Insight website, and I'll give you all that at the end, under our education, under self-paced, we are actually partnered with the Arthritis Foundation, and it's a 6-week walking program, and it lists every single walking trail in the state of Virginia. And you can log this, and it helps prevent falls and helps with our arthritis. So I'll make sure I explain that a little more at the end, but that's one program you can get involved with. The next one is sleep. And we are really bad at getting good sleep. Part of it is because we don't have good, healthy sleep habits due to technology, where we shouldn't be using technology an hour before bed. We shouldn't have caffeine after a certain amount of time. We need to have the room a certain temperature and very little light in the room. And we're just not good at that. We aren't. And what that's leading to is people not getting past that into that second stage of REM sleeping. So we have 3 stages of sleep, and that third stage is REM, but REM has 2 parts. The first part is when we have our dreams, and that second part is the deep sleep after. And you want about an hour and a half to 2 hours of deep sleep a night. And a lot of people aren't getting that. And why that's so important is because that's what helps our brain neurons rebuild after a long day. And if we're not rebuilding those, we're not getting the new cells that we need in those neurons to keep our brain plump and juicy and working. So, we could have the lack of sleep from insomnia. It can be from apnea. It can be from stress. If you really think about when you were younger and you may have gone a full, 24 hours without sleeping, how kind of like your brain was drunk because it was tired. Over a long period of time of doing that can have a long-term effect. So give your body to rebuild those proteins and other brain boosting components. And if you're not getting sleep, talk to your doctor about it. There's there's melatonin, there's prescribed medications, you can do a sleep study and get a sleep apnea machine. There's lots of options out there. So getting that done is really, really key. And we're seeing a big correlation in a lot of people who didn't get good sleep from high intensity jobs getting early onset Alzheimer's. This is something really important to keep track of. If you've got a Fitbit or an Apple Watch or anything like that you wear to bed, you can see what your sleep pattern is. And that will warn you if you need to talk to the doctor any further as well. I also want you to keep your mind active. So do mentally stimulating activities, read books and magazines, play games, learn new things, take or teach a class, and be social through work or volunteering. Doing singing is a great option as well. And just remember, you want to do new things, not all the same things all the time. So a lot of people have downloaded the Duolingo app and are teaching themselves new languages. Do something different. You can stand on your non-dominant foot and brush your teeth with your non-dominant hand every night. Just something new and different to do to use a different part of your brain. Next, I want you to stay connected. And we learned through COVID how valuable this was. So people who have meaningful activities like volunteering say they feel happier and healthier. Social activities are linked to reduce the risk for some health problems, including depression and dementia. Older adults have the highest rate of suicide in our country, and it's due to isolation. About 62 to 64% of older adults feel lonely and depressed. And so it's really important that we don't isolate, that we do things. And we found through COVID, what that ended up showing is that we had people in continuing care communities who were in their apartments where they were isolated because they couldn't do activities. And they already had the start of mild cognitive impairment, maybe even the beginning of dementia. And when they got isolated, it progressed really quickly. And so we had people within 9 months moving into memory cares. And so it shows you the value behind being social and engaging with people. So some places you can look for things to do. Encore is a great program. Doing your area agency on aging can lead you to senior centers and community organizations as well. It's always something to keep yourself, even if it's a phone call with someone on Zoom twice a week, that's something. Okay, so just make sure you're staying connected. And what can we do today? Well, I want you to pick one thing to help your brain offer all those things I just gave you. I want you to think of small first steps, such as taking a 10-minute walk a few times a week, adding 1 serving of vegetables every day that you don't normally have, or schedule your annual physical. And I want you to write down what you're going to do and when. And then if you don't think you can follow through with that, I want you to partner with somebody. It can be a family, a friend, or a community group that's going to make you accountable so those things get done, because it's so important to do these things. So I want you to look at this graph here. We're going to go into the different stages here. So we have normal aging, right? And that's preclinical column. So slight silent phase, the brain changes without measurable symptoms. It doesn't affect you during the day. Then you start to notice some changes that concern yourself or a family member. One or more cognitive domains are impaired, and it might affect a couple of activities. So that's called mild cognitive impairment, or MCI. And then if it goes beyond that and your cognitive impairment is severe enough to interfere with your everyday abilities, that's when you've gotten to the area of dementia or a neurocognitive disorder. So what is mild cognitive impairment? Let's learn a little bit more about that. It causes more memory problems than normal compared to others in the same age group, but it does not significantly interfere with the ability to participate in daily activity. It is not dementia, and it increases your risk to develop potentially Alzheimer's or another dementia. It is an intermediate stage between the expected cognitive decline of someone in normal aging and the more serious decline of a neurocognitive disorder. Mild cognitive impairment may increase your risk for later progression to dementia, but some people with mild cognitive impairment may never get worse. A few eventually even get better. So this is what's really important, and why I tell people getting screened early and getting a baseline is really good. And I have people that come to see me. I have memory screenings today at the Wellness Center in Fairfax, and I do them there every month. I'm at the Ashburn Library every other month. And I have people at the Ashburn Library who are in their 20s and 30s that come to get their memory screenings with me because they want a baseline. And I think that's really important because in the day and age that we have with the stress going on around us and more people having depression, those two things can lead to mild cognitive impairment. And those are things you can get fixed. And just because you have mild cognitive impairment doesn't mean you're going to get dementia or a neurocognitive disorder. Only about 10 to 15% of people with mild cognitive impairment ever have it advanced. And so you can also, if you get the depression or anxiety treated, it could completely go away. And so that's why I tell everyone, don't be afraid of getting tested for that and getting treatment. Okay. So 10 warning signs I want you to look for when it comes to possibly having dementia is there's memory loss that disrupts your daily life. It challenges planning and solving your problems. Difficulty completing familiar tasks. So that could be cooking pasta, taking a shower, getting the newspaper. Confusion with time or place. Forgetting what days of the week it is and missing appointments. Trouble with visuospatial and spatial awareness. This is really effective with people driving. You start taking up 2 parking spots, turning in the wrong lane, that's a red flag. New problems with words and speaking and writing. So that's that aphasia that we were talking about. Misplacing things and losing the ability to retract them. There's plenty of times that I go into a room and go, gosh, I don't remember what I went in there for. And then I remember a couple minutes later. That's normal. If you can't ever come back to it and you forget about it and don't ever get it, or you have to go buy something new because you can't find it. I hear that from a lot of families when they finally realize someone's having a neurocognitive decline. They'll end up finding 50 pairs of gardening gloves because someone couldn't find them and they just bought another set, and they kept doing that every time. Decreased or poor judgments. We're leaving the front door unlocked, the stove on. Withdrawal from work or social activities. Talked about this one earlier. You know, they don't remember names, so they don't want to be wrong. They can't follow conversations anymore. They get overstimulated because there's too many people in the room. And then the last one is changes in mood and personality. So the mood and personality of people with dementia or neurocognitive disorders, they can become confused, suspicious, depressed, fearful, and anxious. So if you see any of those changes in someone, that's something to notify the doctor about. So when we say dementia, I have lots of people ask me, does my mom have dementia or Alzheimer's disease? Alzheimer's is a type of dementia. And so there's lots of types of dementia. We've got Alzheimer's and vascular dementia. That one is more common to get if you have a history of diabetes or hypertension or a history of TIAs or strokes. Then there's dementia with Lewy bodies, which is what Robin Williams had. There's Parkinson's dementia. There's frontotemporal lobe dementia, which is what Bruce Willis has. And then there's reversible ones that we had talked about. You have an infection like a UTI, depression, a brain tumor, metabolic disorders, so your thyroid, medication problems. You start to see an abrupt change and you start a new medication, it's worth figuring out if it's the medication. Vitamin deficiency. So vitamin B6, 12, and D can affect your memory if you don't have enough in your system. And then, of course, alcohol. And there's lots of other things too, but that's just a brief overview of those. So what is dementia specifically? It's not a normal part of aging, and it describes a group of symptoms affecting thinking, memory, judgment, language, and social abilities severely enough to interfere with daily functioning. And dementia isn't a specific disease, it's an overall term. So as you can see here in this picture on the left side, your hippocampus looks great, your cerebral cortex folds look good, looks very plump. And then you go over here on the severe side of having dementia, and you have extreme shrinkage, large ventricles that are open, and then extreme shrinkage of your hippocampus is very common with Alzheimer's. And so a lot of times they do an MRI, they're looking at that specifically to rule out or rule in Alzheimer's disease. So I'm concerned about myself or a loved one. What do I do? What do you do? Well, I want you to go see your primary care physician, and I want you to ask for a couple things. First, tell them why you're asking, and then ask for a complete assessment, such as getting an MRI, your CBC, your CMP, so this is all blood work, a TSH, vitamin D, vitamin B12, and then we want to get a neurocognitive screen. Once you have those done, and we're seeing that there is a need for you to go further, and it's not something that's fixable, then you'll go to a neurologist. And I can tell you in this area, Northern Virginia, and I'm sure the whole DMV area, neurology appointments about 5 to 9 months out for a good neurologist. And so if you can get all these pieces done ahead of time before you go in there, you won't have to go for 2 visits because it will already all be done and in your record when you see that neurologist, and they can start a treatment plan with you on the spot. So it's really important to get those things out of the way, because imagine if you waited 8 months to see that neurologist, then you get that blood work and they come to find out it was just your thyroid and give you a pill. Think of all the anxiety you put yourself through for that whole entire time. Okay, so this helps rule all that stuff out so that you can know before you make that decision to do that next appointment. Next, there's some questions here. And these 2 screenshots I've had with these handouts, I can make sure I get over to you guys if we can put with this recording. These are questions you'd ask the neurologist if you're seeing these changes. So, are you comfortable helping me with knowing what to expect in the future and able to help with medical advanced care plans? If not, who would you refer me to? And reason to ask these questions is because a lot of times it's just like if I got told I had high blood pressure today and the doctor goes, here's a prescription, I'll see you in 6 months. That wasn't very helpful. There's other things we can do for high blood pressure. So we want to guide our doctors a little bit to find out the things that we need to know that they may forget to tell us. The next question would be, will you spend time talking with me about my life care needs that will change over time? If not, who should I go to? So talking about the disease process and what you could be expecting and what you need to do to prepare for that. If they can't have that discussion with you, then that's worth finding someone who can. And there is a code for caregivers under Medicare. So if your loved one gets diagnosed with dementia, the caregiver can actually have an appointment just with the doctor to get all this information. So advocate for yourself for that. The next question is, what can I do to live as well as I can for as long as I can? Because quality of life is so, so important. So does that mean that we do a research study or do the new infusion therapies? Or does that mean that we go take a couple more vacations and we just do a pill? You know, asking all these questions, talking through what the possibilities are. And then how do I get connected with these clinical trials? Is there a local place? Do I go to the NIH? Where do I go for that? And next, should a family member or friend be joining me at all the doctor visits? This is really important. And I even say, even if you don't have dementia and you have a big health diagnosis happening, to always have someone with you, because sometimes you get a little bit of shock going on and you miss some of the important information. And if you can't have a family or friend go, if the doctor's okay with you recording it so you can listen back to it later, that's always an option as well, since we have such great technology now. Next, what are the purpose of the medications you're giving me? You know, don't just hand a prescription and think I'm going to trust it. So I've seen plenty of times where there's a medicine that's supposed to help someone. We had someone who has frontotemporal lobe that I've worked with and was taking these medications, became really passive and wasn't eating and wasn't engaging. And so we thought she was on her downward decline. And when she stopped eating, she wasn't taking her medicine, and all of a sudden she got better. And come to find out, it was one of her medications that was doing it. So definitely ask what they're going to do, what are possible side effects that we need to watch for. And then when's an appropriate time to stop medications? Because sometimes we're taking medications and the reason our heart's still ticking or our diabetes is managing and things like that. So when we get to a certain stage, do we want to stop those medicines and just be comfortable? And ask, is your dementia a certain type of dementia? And yes, that does matter. So for instance, Lewy body, like Robin Williams had, there are certain medications that are interactive with them, and you can actually go into cardiac arrest with some of the SSRIs, those mental health medications. So really important to know if you have that dementia, because you don't want something like that to happen. And also, we can do different types of comfort care for people, knowing what their dementias are and what behaviors might come about. And is there a certain medication or activities that I can do or that I should avoid? I'm sorry. Because there are some things that can be triggering, and we learn those with working with someone. And then, of course, the last one, are there resources I can share with families and friends so they can understand what me and my loved one are going through? And this is so key, because this isn't a disease that we all deal with on our own, isolated. It takes a village, because this is a marathon, not a sprint. And so it's really important to make sure we have all those resources for everybody. So why is it important to have an early diagnosis? Because we can rule out causes and get treatments that can help, especially if it's something that's short term and can be fixed. We can also get on clinical trials the sooner we're diagnosed, because some clinical trials have to be done in the very beginning. It also allows us to be physically and socially active and plan for our future. It's so nice to be able to plan for our future when we're still able to make those decisions and have that autonomy as someone who gets this diagnosis, and be able to say, I'm okay with this person helping me when I can't take care of myself, but I don't want this person to do it. And I know I don't want to burden you, so I want to go into memory care. So if we know their wishes and this plan is written out, we can try our best to meet all of those requests. Some resources for you. Insight Memory Care, of course. We have a day center. We do early stage programs for MCI and early onset, and those are in 3 different locations. We also have tons of education, like this class today, over 20 support groups. A lot of it's virtual, good chunk of it. And that was the gift from COVID that we got. So we have people all over the world participating in our programs. We have special events. We showed the Robin Williams movie this past month. We'll be doing that again in October. You can also reach out to your area agency on aging in any of your counties. And they usually have great resources, whether it's education, day centers, whatever that might look like. Then, of course, the CDC. They have a whole area section on aging that can talk to you about taking care of yourself and research studies and so forth. And then the National Institute of Health, NIH. They have a clinical trials website that you can see what's still up and running and be a part of. And clinical trials aren't always about medication. There's some for caregivers on caregiver support. There's some on how occupational therapy helps, speech therapy. So it's not always about medication. It can be about other non-pharmacological approaches for care with people on this journey. And the more people that do research, the sooner we can get better interventions and possibly better cures and treatments as well. All right, so that is the end of my spiel. I know we have a couple of questions that popped in. If you go to our website on insightmcc.org/events, you can see all the different things that we do. My contact information is up here as well. I'm going to a study for Prevagen. That we'd have to look on NIH to see if there's any active right now. Joan had asked that question. So that's where I would suggest that you go to the NIH website. So nia.nih.gov. You can see if there's any active with that to answer that question, because I don't want to give you the wrong answer. Do we have any other questions?
I have one question.
Yes.
Inquiring about the reference to NIH. Is it too early for you to have seen significant impact on the erasure of some clinical trials and potential exodus of some of our incredibly dedicated public
Yeah.
servants who are moving on maybe to individualized opportunities elsewhere.
Yeah, that's a big question we get a lot of. So we at Insight have not, we have one through the CDC that has been affected. I've not seen any of the research studies affected. I've seen some of the funding affected for better brain health programs, but not for the research studies themselves. So I know what a lot of people are trying to do is go through private sectors to supplement if funds have been reduced or changed. But I also know there's a lot of people out there advocating and fighting to keep these research studies going. We have a couple people that are on the new infusions, and they've done a really great job of keeping that going so these people don't lose that treatment. So we just got to keep fighting.
I'd appreciate, as time moves along, any opportunity to be part of that advocacy on behalf of others. So if staying in touch with Insight Memory Care might enable us to stay current with that, I'll try to do so.
Okay, great. The other thing you can do if you haven't heard of it, it's called the 5 Calls app.
Mm-hmm.
The number 5 calls. It tells you what things we need to advocate for, and you can send letters and make phone calls to your local representatives. And so if you keep an eye on those, that's an easy way to do it.
Great idea. Thank you.
Yeah. I have a question. Can I put programs in to offer support to caregivers? Absolutely. I'm going to stop sharing my screen here so that I can pull up my, actually, maybe I'll just shrink it. All right. Pull up my web browser, and I'm going to get the link for you guys. Give me 1 second here. Here. All right, so I'm going to, this is the link for all of our support groups. And then under our education, I'm going to give you the link for that. So that has webinars with other support, a self-paced learning module, the arthritis program I was talking about. So you can go on that link for there as well. That should get you all things. Yes. So to answer your question, let me go back up. I don't want to miss someone else's here. Okay. Thank you, Peggy, for your comment on the umbrella. Yes, the infusion medications. So actually under our webinars, there are 2. You can actually watch the videos for. And see if I can find them, and I will put it so you can learn. There's one, so one of the infusions is every month and one's every 2 weeks. So there's 2 different for that. Let me see here. So the first one, which just came out in the fall, is the Kiz, I always pronounce it wrong, I apologize. Kizunla. So let me put that one in. The other one came out the year prior to that. And that is the Lequimbia. And I'll put that one in there so you can watch both of those. Those are from neurologists so that I don't missay things. I don't want to do that. And then, so patient programs you can go with your loved one that has dementia. That's a great question that I was just asked from Belle. So we have a couple that you can do with that. And so one of them is memory cafes. So I just put that one in. And then we have a program called Meet Me, which are community outings if you're in the early stages. And so I'll put that one in there. And then the one other one that we just started, I got to go to the calendar. We just partnered with Service Source out of Fairfax. And we're actually going to have a brain health dance class that you can go to with your loved one every Thursday for 45 minutes. And it's free, which is awesome. We're also doing an improv and movement one as well. So let me throw that one on there too. So here's the improv one. And I am not seeing my one for dance. I think we did remove it, and it's going to go back up. So make sure you go on our calendar. So the dance one, we're just waiting for the person's background check to go through, but it should be starting May 8th, if not the week after that. So just keep an eye on our calendar for that one. But it's a dance class for 45 minutes, which is a lot of fun with Cameron. And that's in Fairfax off of Ollie Lane and Braddock. And then my next question is dementia hereditary? It can be. You can carry the gene, but also not get it. So what plays a factor in getting it is that taking care of preventing head injuries, having good brain health, so eating well, exercising, that type of stuff. But yes, it can potentially be hereditary, but only if you carry the gene. But it's kind of one of those questions you get tested for it, find out you have it, and then you sit there and worry, and then you never get it. And you live life concerned. So it's a personal preference with that. But I would say, just do the things that I had suggested, sleeping well, eating well, exercising, socializing, doing brain exercises, and reducing your stress and anxiety. You can do those 6 things every day. It's kind of your homework. I think you can give yourself a better chance that even if it's hereditary, you're more likely for it not to be to progress as quickly, or it may take longer to have it start. So those are things to kind of think about with that. Do I have any other questions? These were great questions. And please know I will go back. I think you guys can still. Yes, you guys still have my screen up, so you have my contact information. If there's anything you think of, I do free consults. So if there's a question you want to ask now, or it may come to you later, you're more than welcome to reach out to me. Fastest way is email, because I'm on the road a lot, and I can answer those things in between seeing people or doing presentations a little faster than doing phone calls. But please know we do presentations all over the Northern Virginia area, both in person and virtually. And you're more than welcome to look on our calendar and go to any of those. We'd be happy to have you join us. And please feel free to share any of our stuff to anyone, anywhere, especially for the virtual stuff, because we can absolutely have anyone from anywhere join us. We want to help as many people as we can, because this is not an easy journey, and it's a long journey. So we want to make sure that we're getting the support out to people who need it.
If there are no more questions, I would just like to thank you, Melissa, for this very enlightening presentation and for all of the resources you've given us. Yeah. It's one thing to listen and to participate, and another to actually have resources you can take with you on the journey, whatever journey you happen to be on. So yeah, we so appreciate your spending your time with us this evening.
Absolutely. And I'll email over the 2 screenshots that I had that were actual handouts that we have for people as well, in case they would like a copy of that. But thank you for having me.
And you noticed that I forgot to push the record button at the very beginning, so we lost about the first 6 minutes of this.
Well, if you need me to re-record, just let me know.
That would probably, because we do like to send the recording out, we do like to post it. So maybe if you want to hang back, we can figure out how to make that happen. At least put the pieces together and have it have a whole presentation.
Yeah.
And I apologize for that. That's because this is new to me too. So.
Absolutely. Well, thank you guys for everything. And I am honored that I got asked to do this, and hopefully I'll be back in the future.
Sounds great. Good night, everyone. Have a good evening.